I had a pulmonary embolism in 2003. That pulmonary embolism almost cost me my life.
Our current healthcare system presents multiple challenges to effectively manage chronic disease. System fragmentation means chronically ill patients receive episodic care from multiple providers who rarely coordinate the care they deliver. Because of this structural deficiency, patients with chronic illness receive only 56% of clinically recommended medical care.
Being overweight and having type 2 diabetes, hypertension, he determined that I'm what's called a person with metabolic disorder. So Dr. Quinn recommended that I start a health maintenance program which included dietary management, exercise, weight loss, therapy, in as far as speaking with the person who was a life coach. And in the 6 to 7 months of doing that, changed my life. I actually lost over 52 pounds. I noticed that I had more energy. It was phenomenal that I was able to do things that I had not been able to do for the last 6 to 7 years.
The patient-centered medical home is emerging as a leading model for efficient management and delivery of quality care.
It enables the patient to push the information from one place to another at their direction.
They can see their x-ray, they can see their data, they can see their information. They can then be a part of their care, and the care can end up being centered on the patient.
In Vermont, physicians, patients, administrators, and politicians have joined together to establish a medical home model that is showing tangible results.
Because the chronic care model looks at having a good IT system, having patients become their own advocate and taking responsibility for their own care, in a way, the medical home just made sense in terms of taking the chronic care model where we were really focusing on patients' chronic illnesses and expand it into all aspects of care.
A cost-efficient, high-quality healthcare system will need to find ways to coordinate patient care given by multiple providers.
When patients transition care, they go from home to a hospital, they go from hospital back to home or to a nursing home. At those transition points, patients frequently will fall through the cracks. That's when medication errors happen. That's when the right hand doesn't know what the left hand is doing, and mistakes can happen and patients can suffer for that. So I try to bridge that and talk to caregivers, make sure that everybody understands what is supposed to be happening for that patient and any questions get answered.
An estimated 90% of the care chronically ill patients require must be self-managed outside the health system.
It requires phone calling to patients to make sure that their medicines are all up to date. It's phone calling to patients to make sure that they're getting into local support groups or local workshops in how to deal with their chronic condition. And that communication back to the provider to say, you know, patient maybe is having a little bit of difficulty with their asthma medicine. Can we change that a little bit? And it keeps the patient at home and in control of that, rather than always waiting until they're so sick they end up in the hospital.
If I didn't have that level of support, I believe that I would still be in the place I was before. Someone getting out of the hospital, someone struggling with my weight, struggling with my diabetes, struggling with my hypertension.